Hi, my name is Lisa Voigt. I am a clinical pharmacy coordinator at the Buffalo General Medical Center. I'm here today to talk to you about the good pharmacist, and hopefully I can provide some insight on what it means to be a good pharmacist. And just to begin, I'm just going to give a little bit of a background of where I trained and how I got to where I am. I received my bachelor's in pharmaceutics at the University of Buffalo in 1999, and then I went on to receive my doctorate in pharmacy from the UB School of Pharmacy and received that in 2002. And after that, I went on to the University of Rochester Medical Center to complete a PGY1 residency program, followed by a PGY2 residency program in critical care and emergency medicine. And so by completing those residencies, I feel that that's how I've gotten into my position today as a clinical pharmacist. So throughout the years of school and throughout my training, I've learned different aspects of pharmacy, and I've provided different care to different sorts of patients all throughout my training and throughout my career. I first started actually as a pharmacy intern at Phase Drugs, which is a community pharmacy which was bought out by Eckerd and now most recently Rite Aid Pharmacy. I also did an internship simultaneously at Millard Fillmore Gates Hospital in the hospital setting. So I kind of have a little bit of background in both community pharmacy and hospital pharmacy and seeing the different aspects of how patient care is handled in both situations. I can tell you that both paths are very rewarding if you were to become a pharmacist today. And as you're sitting here in class, I would like you to think about that you've chosen a great career, and it's very honorable that you're sitting where you're sitting. And I encourage you to take advantage of the path that you're going to take, no matter where it may lead you. Working in a community pharmacy is very rewarding by seeing the patients. You actually get to talk to patients. Patients will come up to you to the counter, and it's interesting how they will actually try to avoid their physician and provide their trust into the pharmacist first. You're well known to the community population as the person who knows about drugs. And this is something that we all possess by the end of our pharmacy school career. You're the drug expert, but it's much, much more than that. And I think some people along the way, and the way corporate has taken over, we sort of lose that sight of how we are just there to fill prescriptions. And I can tell you that there are many positive patient care impacts that we have as pharmacists. We are among the top 10 trusted professionals in the nation, and I think we need to live up to that. In the hospital setting, we're also to provide a service to patients as well as other healthcare professionals. So I believe as you're going through daily work activities and you're thinking, that you're able to process orders, you're able to fill prescriptions, and no matter what setting you are, it's much, much more than that. And I think we all have to realize and remember that there's always a patient at the end of what we're doing. Working in a more hospital setting now, I realize that we have more customers than just patients. We have more customers such as nurses, such as physicians, and you really need them to trust you as well because you're making decisions that ultimately impact them and the patient. We lose sight and we lose focus, I think, in the hospital setting when we process orders and we're sort of segregated from the patients and we're segregated from the physicians and nurses. Yes, we speak to people on the phone, just as in community. We get to call them. We can call them about what's wrong with orders. We can call them to change something. But it really makes it important for that face-to-face contact, not only with the nurses and physicians, but with the patients as well. It's interesting in a hospital setting when you don't realize that, and sometimes the patients don't even know that there's a hospital pharmacist involved. So we often try to focus on patient counseling from the pharmacist's perspective in a hospital setting. We should understand that just because we are dispensing medications to the nurses, that the ultimate end user is the patient. Pharmacy is changing in this time, and I think we need to understand that it's going to be much more different than it is now. With healthcare reform, We are not just going to be able to sit back and ride on our coattails of our education. We need to focus on changing the practice of pharmacy, and who better to do it than us ourselves. I'm also a member of the Western New York Society of Health System Pharmacists. I am the immediate past president, and I am currently the Director of Communications for the New York State Council of Health System Pharmacists. It is important for you as you think about getting involved with other professional organizations as you advance through your pharmacy career. Not only do you get to network with other pharmacists in the area, you can interact with them on a state level and also a national level. By getting involved in other professional organizations, you can also interact with other healthcare professionals, nurses, and physicians. I'm also a member of the Society of Critical Care Medicine since I practice as a critical care pharmacist at Buffalo General Medical Center. These meetings and these conferences provide you with valuable insight and where the whole healthcare profession is going. And I believe that if you would like to change what's in healthcare and what's going on in pharmacy, then you need to be actively involved. It's very difficult for someone to sit there and tell you what to do, and if you don't agree with it, but you don't do anything about it, then there's nothing that's going to change for you. It's very important to realize that you're going to have to advocate for your own profession. As managers that I speak with, my boss, we often talk about who's going to be the next pharmacy manager. And you would hope that it would be a pharmacist, but there comes a time that there might not be a pharmacy manager who is a practicing pharmacist. And these people may not understand what we stand for and what we fully believe in. Again, realizing that the ultimate end user is patients, and our patient safety is a top priority for us. Not only can we catch medical errors and prevent them from happening, we need to be on the front line of deciding what medications the patient should get and not on the back end. Preventing a medication error can happen with you while you're speaking with the physicians and avoid it ever even reaching the patient. There's a model called the Six Sigma model, which is, it's actually the airline industries use it, and they often reference it to the Swiss cheese model. And they often show this video of pilots fiddling over a button, and the ultimate end is that the plane crashes because nobody was focused on the main situation. It happens in hospital and happens in community where you think that the physician writes the correct prescription, the pharmacist doesn't catch it, the nurse doesn't question it because they think that everybody else has reviewed the situation. And ultimately, the patient gets the wrong medication, they get the wrong dose of the medication, and a serious adverse event can occur. As pharmacists, it's up to us to question if something isn't in our gut that you feel is right. So don't be afraid to question things, to look up things, to ask opinions of other healthcare professionals. You want to do the right thing for the patient, and I think that's the ultimate thing we need to remember. Can you edit some of this? No. And finally, I would just like to thank the D'Youville School of Pharmacy for letting me speak today on the professionalism of pharmacy. I think it's very important that we as pharmacists come together as a profession and not stand divided no matter what profession or what path we take. Whether it's community, whether it's institutional, whether it's research, our ultimate end point should be the same. And I fully believe that we can all do this if we stick together as a profession.